Hi, everybody. Welcome. I'm Susan Marshall, author of Mom's Gone Missing, When a Parent's Changing Life Upends Yours, and your host for Compassion Chats, a monthly conversation for caregivers and resources to us as caregivers who have all kinds of answers that sometimes we don't even know the questions to yet. So welcome. I am super excited. Before I start and introduce Debbie, these Compassion Chats happen every month, the fourth Tuesday of the month at 6 o'clock Central. We're committed to a fairly brief format, 30 to 40 minutes, but we absolutely will stay and chat with anybody who wants to for up to an hour. So you can kind of gauge your time on that, stay as long as you like, up to an hour. So I'm super excited and very, very honored to introduce our guest tonight. Debby Deutsch is a board certified patient advocate. We're going to ask about that. And founder and CEO of Patient Care Partners, LLC, serving Madison, Wisconsin and beyond since 2016. I met Debbie in the course of learning about people I never knew existed. So super excited, Debbie. So glad you're with us. Welcome.
Oh, thank you, Susan. I am so appreciative of this forum that you're building, and I love that it's very friendly and it's very engaging, and it's really to kind of, take each other's hands and help each other through.
Absolutely. So we have questions for you about your work, but before we dive into your profession, it's always kind of fun to get a peek at the person behind the profession. So my question for you as Adele knows was my question to her. What got you into this work? What got you started doing this?
It was quite a journey. I trained about almost 20 years ago to be a hospital chaplain. I trained here at Meriter Hospital in Madison through a clinical pastoral education program. And my goal was to go into ordained ministry. And I had been accepted at Northwestern University. But while I did this training, I spent a lot of time in the ICU and a lot of time in the ER. Those were my assigned units. So I saw a lot. Spent hundreds of hours bedside with patients, but I also along the way got to know hospice nurses, and I thought, wow, that's pretty amazing work. So I was poised to start seminary in September, and I got recruited by a large hospice agency here in Madison. So I was really at a fork in the road, and which way do I go? And my parents, who are lovely people, said, your kids really need you right now. They're teenagers, and that's quite a commute. And why don't you work for hospice? Seminary will always be there. So I went to work for hospice, and that was a very eye-opening experience for me because I started to develop a real feel for how some patients really slip through the cracks. And it's not due to anyone's fault necessarily. It's just the way our system works. And it's getting more complicated, honestly, than it was even then. So I started to really deeply think about this. And I would see things, but I really couldn't do anything about them because I'm not a physician. I'm not a nurse. There were so many things that I couldn't do, but I could see, and I could see that there was something wrong. Through about an 18-month period, I lost my dad and my younger sister, and I followed them before their deaths through ICU stays, and in my dad's case, in and out of rehab, and just, it was just very difficult. And I realized then what it felt like to be a family member, and I just thought, this is crazy. I remember distinctly thinking, I wish somebody would take 5 minutes to please explain to my family and I what is going on. I mean, we're pretty smart, but we don't understand this. We're frightened, we're scared, we're angry. And to me, it was just like the worst feeling ever. And when my dad passed away, I was really in a funk. And my husband said, you know what? You need to step back. You cannot work for hospice anymore. Just take a break, go be a volunteer. We'll figure this out. And in that time period, I stumbled upon a graduate program here at UW-Madison that's offered, it's offered within the law school, and it's specifically in patient advocacy. And I thought, oh, wow, I'm going to go back to school and I'm going to learn about this and get some kind of credential. And maybe I can help with this in some way, because I believe it to be a problem. And I just want to learn more and see where that takes me. So I loved being back at school. I loved being on campus, and I just loved everything about it. But it was a rigorous program. And as I was in school, I was like, what am I going to do with this? How can I make a difference? And it became very clear to me that if I became a patient advocate and I worked in a hospital system, and there are such things, or if I worked for an insurance company, I couldn't really solve the problems of the patient, because I would be beholden to that system that was employing me. And in my eyes, that was part of the problem. And I thought, I'm going to start a firm, and it's just going to be me to begin with. And I'll see where this takes me, and see if I can do what I think I can do. So I am a former business owner, so this wasn't my first time around the block, but it's pretty crazy to be an entrepreneur and to be a solo practitioner and all of that. But I made some friends along the way. I made a lot of friends along the way, and I, in particular, um, got to know first two RNs. One who I used to work with at hospice, actually. And I started to say, well, I would really love to have an RN on my team, because I could have someone that could look at these cases through the clinical lens that I lack. So slowly, I started to build this team, and I now have a team of 5 incredible, incredible women. And we all have slightly differing backgrounds. One is a social worker, one is a medical billing advocate, 2 are nurses, and then me. And I also have a woman who's a chaplain and a grief counselor. So between us, there's not a lot that we haven't seen in healthcare, and we have many, many years of experience between us. So when I'm listening to folks and they're presenting their problem, and I'm trying to figure out if it's something that we can help with, I'm thinking, okay, nursing, social work, medical billing issues, how can, what combination of us would best serve this patient and family? And it's, we love what we do, and we're solving some real problems.
That is phenomenal. I listened to this, and there are so many threads we could take, right? In 30 minutes, we can't cram it all in.
I
So
know.
we have to have 14 different sessions. But as I was thinking about what you do, Debbie, and how you've built this business, the board certification seems like that's the foundation. What does that mean to me and to other caregivers if we were to look for someone who would advocate for not only me personally, but for the family and for our loved one? In my case, obviously, it was Mom. What does that mean to us?
That's a really good question, and I can tell you exactly what it means. It means someone and it might be, it might be a nurse, it might be a PA, like my friend Deb Lewis, who is on and is also board certified. It's somebody who has said, all right, I might have another set of credentials, but I deeply care about the art and science of patient advocacy, and I am going to seek further training. And not only that, I'm going to sit for a very rigorous test that it was first offered in 2018, and I sat in the first cohort. And just to give you an idea of how small this industry is, when the first cohort sat for the board certification, there were 133 of us that passed. So in the entire United States and Canada, there are 133 of us, little foot soldiers out there. And it's grown since then. The test is offered twice a year. It's grown since then. I think we're up around 700 board certified patient advocates. But what you can be assured of is a board certified patient advocate has studied and agreed to practice a certain ethical standard. And that's a big deal. I think of it as nursing, back when Florence Nightingale in the 1860s had her lantern, or back in the 1920s when social work was becoming a discipline. That's where we're at with patient advocates. So we are truly pioneers. But I can tell you, in 6 years of practice, it's changing. I'm not constantly preaching the sermon about what I do. People, they understand it. They might have worked with another advocate, or they know a little bit more of what they need, and they can kind of formulate I know I know I would like to work with you. Here's what I need from you. Can you help me? So we're making strides together, this small little army of us.
That's fantastic. So I was thinking about this. As you know, I just plowed through what I had to do over a period of, a couple of years. First dad's funeral and then all of the things that happened. So let's say I'm a caregiver and I am absolutely immersed
Mhm.
in major decisions that need to be made, activities that need to be done, family crud. I'm exhausted. I
Yeah.
don't know who to talk to, but I'm here now and I'm listening to you and I'm thinking, you know what? Maybe she could help me. What would I say
Mhm.
if I called you? What help me understand what you need from me as a caregiver to first of all settle me down, right?
Sure.
So
Yep.
I can kind of start to systematize these things. And
Yep.
then secondly, that you're the person because you're board certified, even though I don't really
Mhm.
know what that means, but it sounds important. Okay. What I'm on the phone. What should I say to you?
Well, that's an interesting phenomenon in itself, because often when people call us, and by the way, I'm the intake department, so even if they're calling our 800 number, they're getting me. So they call me, and so often people, they're teary, they don't even know where to. There. I, are you okay now?
Yeah.
Yeah.
Okay, I don't know what happened there. So anyway, I was just saying how folks are often, they're so overwhelmed when they call that they don't even know where to start. So I, and as I'm listening to them, I'm trying to discern, what is going on, who's the patient, what have you tried, where have you been so far? A lot of times people will tell me, I've been to the ADRC, Aging and Disability Resource Center, for example, or I've been to the senior center, or I've got a social worker, and those are all wonderful things. And they're often supports that are at no cost. But what people interestingly tell me so often is, I've tried this, I've tried that. My problem is such that I need more. And this is very individualized. I'm very emotional about it. This is my husband, this is my son, this is my sister. I don't know how this works. I don't know where to go. I feel like my doctors aren't listening to me. I mean, I hear all of these things in the first 30 seconds of a conversation. So we just kind of start. And sometimes I'll be very honest. Sometimes I say, you might want to start here. I'm hearing that this particular community resource might be your fix. Best of luck. Feel free to keep in touch. And more often than not, people will say, yeah, I tried that, but I need more. And I need someone who will consistently walk down this path with me, even if the path is short, even if the path twists and turns and it's a longer path than either of us could have guessed. And that's okay. It often happens very organically. And here's an example, Susan. So let's say, like with your mom, and I read your book, by the way. I encourage everyone to read your book, Mom's Gone Missing. So you were at a point where you knew that mom needed a higher level of care. But what is that? Is it memory care? Is it assisted living? What does that look like? So often families are like, I don't know. I don't know how these care systems work. I don't know what the levels of care are. How much does this cost? What do I need to look for when I'm looking at these facilities? Oh, and by the way, I'm in California and my mom is in Cincinnati and my siblings, and you can just see that there's a lot going on. So we just kind of we start down this path. And often, I mentioned that I work with three fantastic nurses, and often we'll do a nursing assessment, right at the beginning, and we'll say, okay, you might also benefit by a nurse advocate who can, look through your diagnoses, look through your um, whatever the treatment plan has been that's set up for you, changes in cognition, that type of thing, that can be very, very helpful. And then families or patients themselves are like, oh, this is really cool. I kind of have my own nurse. I love this. So that it kind of happens organically. And then, some of these cases, like finding assisted living or memory care, very short term. But often what happens is we think we're going to be closing a case, get mom or dad settled, and then they say, well, wait a minute, we've loved working with you, you can't leave us now. So we continue. But it's important to note that even with our most complex cases, we're not working for anyone for 40 hours a week. This can be very intermittent support, but very timely, very, very timely support.
Yeah, it's interesting you say that, Debbie, and I think that's such a critical piece for caregivers. I had some idea just because I had seen Dad's journey,
Yes.
and it was 10 plus years long, right?
Yep.
However, I kind of assumed that because Dad had taken a very long time, that
Mhm.
we had some time with Mom.
Yeah.
And at his funeral and other interactions, you know what, we don't, but we had no idea where she was on this spectrum. And so had I known you, right? I mean, you would have been tremendously helpful. That said, trust is essential.
Mhm.
And when you're dealing with caregivers who are out of their minds, they don't know what's up, they don't know
Yep.
who to trust, you sound good, and you have these nurses, and it's just like, I think I need that, but I don't know who to trust. And oh, by the way, I have a responsibility for family finances.
Yes.
What's this going to cost me?
Yep.
What am
Yep.
I committing to?
Yeah.
And how do I know it's the right thing? So it's all of
Yeah.
that uncertainty and
You bet. And we are very careful to address that right from the get-go. So I always offer, if someone calls me and starts to tell me what is going on, I always offer a no obligation. Let's do an informational meeting with you, perhaps family members, whoever would like to be on this meeting. And I'm very generous with my time. And sometimes I pull one of the nurses in as well for this. And it's simply a meet and greet. We want to hear about the problems that you're facing. While we're listening to you, we're thinking, is this something we can help with? Or should we refer to another community support or another advocate who might be a better fit? Is this outside of our scope? So we're constantly thinking of those things. And we're also very careful to explain to patients and families, you are hiring us, much like you would hire a CPA to do your taxes. So we're very transparent in that, because I believe that lack of transparency is one of our inherent problems in our healthcare system. So
amen.
I want to be absolutely above board. This is how much this is going to cost. This is how long we think we're going to need to solve the problem. I'm going to be sending you or emailing you an invoice every month. I want it to be uber clear, every line item, what we, if we billed you for half an hour, what did we do in that half an hour? Because to me, that's just a very high level of customer service. And that's something that is part of the frustration that families might be experiencing. So we're just very above board about that. And we also make it, quite frankly, we make it very clear this is not an ongoing relationship until the end of time. It might be very finite. And, this happens only very rarely, I think twice. We have not continued with a patient because of some compliancy issues, and so, but we also tell the patients and families they can stop this support at any time. That also is very rare. We usually take it to the finish line and put a nice bow on it. But we're very upfront about that.
So I'm listening to you and I'm like, you know what? I'm good. I wish I had known you, right? As I've
Mhm.
said so many times with all of you on these things, I'm like,
Yeah.
geez, I did all this by myself. I'm good. But you know what? I've got 5 siblings.
Yeah.
They're nuts.
Yeah.
How do you manage family dynamics? And do you get engaged and involved in any of that?
We do. So a very good example is a family we're currently working with. Actually, I will not do anything to reveal this person's identity. She was in an independent apartment when we met her with some memory issues. Family hired us. One son is in Washington, D.C., one son is in Texas. Um, she's got a couple brothers that are, everyone is scattered. Um, Part of their problem was that none of them are here, and we are here, and patient is here. So they were having a very difficult time understanding what level of care mom might need. So they needed kind of that nursing assessment. They needed communication right from the get-go with the she was in a large, or she still is, in a large continuity of care complex, but in independent living. It's COVID, by the way. That's a whole other thing. So there were visiting restrictions, lots of complications to this. So we established a relationship with mom and the caregivers that we are not caregivers, the family members that we are in regular communication with. We helped get mom care transition to memory care, which was very appropriate for her and very timely. And by the way, as we're starting to do this, she became a wander risk at the facility and left a couple times. I mean, can you imagine how the family was like, oh my gosh, we need to get this going fast. And the facility was saying, yes, you do, because we're not sure if we can keep her unless she's in a proper level of care. So we transitioned her to memory care. We have been instrumental in regular visits, even through COVID. So they were by Zoom, and telemedicine visits, which of course still continue, and communicating with her caregivers in memory care, and communicating with all the various family members, each of whom has their own questions and concerns, and then addressing whatever those are. So it's complicated, but it's not impossible. And this family highly values this type of support because they're not here. And they, as wonderful as this care facility is, they're limited in how much time they can spend communicating with multiple family members. And that's just the truth. Caregiving care teams are stretched very, very thin. Even every care facility is stretched. They're all stretched. So we have come to be allies with the nurse and the social worker at the care facility because we can help them in these complex communications with family members and managing those dynamics. We make their job easier. So and the same is true of the healthcare teams outside of their care community. So the physicians who are caring for patient but not able to get into the care facility, we can communicate what is going on with her day-to-day care. So that becomes a win-win.
That's wonderful. And I think about, as I wrote in the book, how we tried to get the family coordinated in terms of information. Because I was talking, 3-4 hours at a time with all of my siblings. I'm like, I'm burned out, guys. We tried conference calls. And because there are siblings that did not, and to this day, do not like each other, it's like, okay, that wasn't a very good idea. But it would have been helpful to me as it was when it got to the financial stuff to have someone else providing the information to my siblings, even though it might have been the exact same thing I would have said.
Yeah.
Because it came from an external source, it was more acceptable, right? Yeah. And I, again, as a caregiver in the midst of just swimming in this sea of uncertainty and terrible feelings of inadequacy and fatigue and irritation and all of that, I think that's tremendous. What that triggers for me, question going forward, is like hospice offers family support for up to a year after someone passes. We did not use that in either dad's case or mom's case. Do you provide any of that post passing care?
We do. So we, as I mentioned, we have a grief counselor chaplain. And it's interesting because you're right, hospice does provide that. That's a free community support that you can plug into. So we would first suggest that. But sometimes the family says, that wasn't a good fit, or we don't want to go to the hospice facility for these group things or whatever. So in some instances, they're like, yes, we would really like someone from your team to continue with us. Another thing that is really common with families is they talk about, the binder of the insurance policies, but nobody, it's like a secret. Nobody knows what kind of policies mom and dad have. Nobody wants to go through that scary big binder. So often my job is right. So often, we're the ones who go through the binder, figure out what kind of benefits they might be able to tap into, and then get that going, get that rolling. And similarly, Medicare and Medicaid is a mystery to a lot of people, and they don't want to talk about it until it's a wily problem right in their lap. So in some instances, we can talk to families about what is called the Medicaid spend down process, and you can protect some of your assets and become approved for Medicaid. This is not something we can do. This is something that you have to have an attorney, an elder attorney, do for you or with you, but we can get them on that trajectory. And these are things that families, they just don't know. They don't know that there are possible options like that out there. So it's our job to not only listen to what's going on and pivot through all of the changes in care, but be aware of what we can also bring to the team that the family might not know about. So it's like you're building a football team, and you're bringing in players and you're benching players, and it that's just how it goes. We can't do everything, but we know who in our community we can bring in to help with a need that we can't fulfill.
So that I have two more questions, and I love the football analogy. So, because I'm a football junkie, as most people who know me know, what do you not do? Do you do onside kicks, or do you say no, we don't? So
What
what
do
do
we
you
not
say
do?
no?
So we cannot give legal advice.
Okay,
So we refer to elder attorneys or other attorneys. We don't do hands-on nursing. So we're looking at the patient, not me, but the nurses I work with are looking through the patient's care with that clinical lens, but we're not doing dressing changes. We're not doing catheters. We're not doing colostomy bags, none of that. But interestingly, what we are doing often in that vein is, let's say we bring in a home care agency or a private duty caregiver. We're often teaching that team or supervising that team, because if there are issues going on with the home care team, the patient is loath to make any waves. And so usually are the family members. So we kind of become the supervisor and fix the problem that's going on there. Um, what else do we not do? Oh, we don't do anything in regard to finances. I can translate your long-term insurance benefit. I can explain to you how Medicare and Medicaid works. I can help you with a federal disability application, but I'm not going to balance your checkbook. And I don't want to, I don't want to know what's in your will. We cannot give financial advice, none of that, but we can help translate it. We can help a family understand, okay, you're looking at long-term care. It's going to cost about this much. I mean, it's pretty sobering for families, but should we be looking at Medicaid spend down? I don't know, maybe. Let's talk about it. So that's kind of, those are things that we cannot do. Hands-on nursing, legal advice, and financial advice.
okay. Thank you. I appreciate that. Last question I have for you, and then I want to throw it open to
Sure.
anybody else who's with us. Um, you've seen it all, right? And you've seen lots and lots of family dynamics.
Yes.
What is your best advice to a caregiver, regardless of where I as a caregiver might be on my journey? What is the one thing you can tell me that you know because you've done it and seen the result that helps me as a caregiver?
I would encourage folks. I think that when, as human beings, when we get stressed out, I know myself, I just tend to draw in, and I'm just like, I'm just going to be really quiet and I'm going to figure this out myself. Some of these things, our healthcare systems and our insurance systems and federal benefits and state benefits and local community supports, it's so much to try to figure out, particularly if you don't have any medical background. So I would, again, I'm going to go to the football analogy. I would say, okay, this is my problem. I am probably going to need at first it might be a little team, but I'm probably going to need a team to help me. Who can I identify as people that will take my hand and really help me figure this out? It might be a social worker in the patient's clinic. It might be a community group like out here in Madison, we have a wonderful grassroots group that is for parents of special needs children. Wonderful group. It might be something like that. It might be family members or friends who are anxious to help you, but they don't know what you need. So you just need to start thinking about, okay, I am not going to try to figure this out by myself because I won't make it. I'm eventually going to crash and burn. Who are my allies? Who can help me figure this out and get from A to B and understand what's going on and help me when things change, because I promise you they will change, and they might change very quickly. So that's really what I would encourage folks to think of. And I have been there. I get it. It's so I will never forget the feeling. And honestly, this happened. My dad was very ill. We had decided that we would try to bring him home with private duty nursing, and my parents were prepared to pay for it. This was almost 6 years ago. My parents live in Indiana. We had been there. I came back to Madison. I Googled private duty nursing in Indiana. I was like, how can I not find anything? Where are these people? I finally started calling agencies, and you often had to fill out like an online, like an info form. So I thought, wow, I can't believe this is so hard. I want to hire somebody. And honestly, we had to go back down to Indiana because my dad took a turn for the worse. I got a call back from an agency 4 days later. She was a nurse in New Jersey. I said, how can you possibly help me? You're in New Jersey. My parents are in Indiana. And it doesn't even matter because my dad is dead. And I thought to myself, I'm a pretty smart girl. I can figure things out. But I was astounded that there was nothing. I mean, there was nothing. There was nothing. So that was pretty sobering for me. Now, looking back, could a hospital social worker have helped me? Probably. I'm not going to blame the hospital system, but we felt like we were on our own. And when I went to try to figure this out myself, I couldn't do it. And I thought I was, I thought I knew about hospice and home care and all those things. Mm-mm. It was hard.
Yeah, I think that's a really good kind of summary of where many caregivers at least start.
Mm-hmm.
And I certainly can agree with that. Oh, I'll figure it out.
Yeah.
I don't really want to share this with anybody else. I don't know what I'm dealing with. I don't know what help to ask for. I'm not in the mood to go to my friends and go, hey, I'm a mess because all this is going on. You just withdraw.
Yeah.
And you're like, going to help. So as you recommend, making your list of allies, honestly, Debbie, when I started, I didn't feel like I had any.
Yeah,
so
I get it.
Is that my first reason to call you and say,
yeah,
I don't know what to do. I don't know who to trust. Can you help me work through this?
We can help you at least get started. And what we see, as I said before, what we often see is we think, oh, this is just going to be a short, we just need to help them get from A to B. We think it's going to be very short. But so often what happens is a really incredible relationship is built, and there's a lot of trust that goes back and forth. And what families say to us over and over is, I couldn't have done this without you. I could not have figured this out on my own. Please don't leave me. I need you now to help me with billing issues or whatever it is. And another thing that's really, really important to remember, and I probably was dealing with this with my dad, I was an emotional wreck. This was my dad. And I was looking at my mom and going, oh my God, my mom is going to fall apart. My siblings are, I just wanted to knock their heads together because nobody was helping me. But there are those emotions. And that can also stop you right in your tracks as well. It's just what it is. So that kind of makes for the perfect storm of it's just a perfect storm.
Well, and that's why I love the term patient advocate, because we need advocates. We need supporters. As Marty Schreiber, Adele's friend, talks
Yes.
about we meet canes, right? People who support us, people who hold us upright when we feel like we're, going to crash and burn. And so you have a whole team of canes, which I think is really,
Yeah.
really wonderful.
Yeah.
So thank you, thank you. I want to open it up for questions.
Yeah,
Anybody
please.
here, jump in.
Well, I just wanted to say, I think what you do is so awesome because there's people that are in this, they're thrust kind of suddenly often into an extremely stressful emotional situation. And you help them realize that one, you don't have to do this alone. And two, we're gonna empower you with the knowledge that will allow you to make the best decisions for your loved one. And that must just be like this huge weight just gets lifted and they can take a breath for a minute. So
Yeah.
it's cool.
Thank you. Thanks, Deb. And I know you've done this and with a family member and you know this, and you're also a medical professional and you're also a board certified patient advocate. So I appreciate you being here and I appreciate your thoughts.
Yeah,
I've got a couple of questions. My first one is, I'm curious, when we go into something new like this, we usually have a vision of what it's going to look like, how we're going to go down the process and the path. And somewhere along the line, I find that when you pause, which might not be for a while, and you look back and you say, wait a minute, this isn't what I was picturing. This isn't how I envisioned this to be. I'm curious if that happened to you, and if it did, what was the surprise or what was the recalibrate or the recognition somewhere down the path in the earlier stages?
Well, I'll tell you, and I don't mean to sound hippy trippy here, but I have felt my dad's hand again and again. And I think that he's given me a little boost from time to time.
Mm-hmm.
And I think that, I honestly would just think, I really wish I could work with a nurse. I really would love to work with a nurse. And honestly, it was like the next day, this wonderful nurse appeared before me. And it's been the most incredible thing. And it's all happened very naturally, very, very naturally. And I never would have believed that we would be where we are now, and I'm not saying that it's all about me or my team. It's about the people that we're helping and the real ways in which we are solving complex problems. And it's one patient at a time. And I think it's fair to say that my team and I all believe that this is the most valuable work that we've done in our careers. We are thrilled to not be part of any system. We are thrilled to be truly serving our patients and families in relevant ways. And it gets me up every morning. I can't wait to see what's going to happen. It's crazy, but it's good. It's really good. So thanks, Adele.
So, as you described that, though, that is what I believe to be, number one, divinely inspired. You're doing the work that you were intended to do. Number two, you're doing it with the right intent, and I'm all about intent. And number three, it's organic. So you're following it. You're not trying to pull it along with you. And trust me, I've been learning that lesson over the last year or so. So that makes absolute sense to me. And I think that's where the success comes from, is with the right intent and the right team and the right, just the way you're going about it is organically. So my other question was, what is the most, and this might be a hard question, maybe impossible to answer, but what is the most basic or requested or needed service that you offer? If you had to, I'm sure there are different kinds of service lines, is the wrong way to describe it, but
Sure.
What is the thing that most of your clients need at some point in time or on the path? What's frequent?
I would say that the most frequent typical client for us, it's two. One is a very, they're usually older folks. They might be retired, they might be not, they might be in their 40s, but they are very, they have a very proactive way of looking at their life, and they have decided that they want to stay in their beloved home and they don't want to be a burden on their children. They don't want to be a burden on their friends. And they want to, this is how they want to live out the next 30, 40, 10, 5, pick a number, years. And they say to us, okay, this is what we want. We want to stay in our home. We realize we're going to be adding to our team, and that's okay, but this is what we want. We do not want to go to a care facility. We want to stay out of a hospital if at all possible. Can you help us with that? So with that goal, yeah, we can definitely help you with that. The other thing that we see most often is, well, there's two other things. Another is what we call solos. And those are folks who, again, can be in their 40s or in their 70s, but they're not married. They don't have kids. They too, they don't want to be a burden on anyone. They want to call the shots on their own as much as possible, but they realize they need a trusted advocate that will follow them through, many, many years, in some cases, of healthcare and possible changes, even though they're very healthy today. They might need someone to be their healthcare power of attorney. In some cases, we do enter that relationship, and they're just, they're kind of flying solo, and that's the way they like it, but they want someone when they need someone. So we're their emergency contact and that type of thing. The third thing that we see most often, and this was me, and this was Susan, is an adult child who is losing their mind, and they don't know where to turn. And they're trying to figure it out for their parents. They're trying to work with their siblings. They've got their own lives. They've got kids. They've got a job. They might be out of state. So those adult kids are the other, that would be the third most common scenario that we see. But it's important to note, this is a dementia and Alzheimer's group. I realize that, but we work with, special needs kids and their parents, infants. I mean, anyone at any age can stand to benefit by working with a private patient advocate. So it's not all seniors. It's understanding what is going on with the patient and how we can help them through this.
Thank you.
Those were great questions, Adele. Thanks.
Susan, you're
Sorry, it's like, it's interesting as we have these conversations, and as we will continue to, as these chats grow, this community is going to do nothing but grow. And our mission here is a couple of things, as you know. One is to just create a group like this where we can just talk to each other and say, I am losing my mind. I don't know what to do. Who should I call? How do I do this? And then secondly is truly to create a group of people who know how to at least have these conversations. Adele, your chat last month was so beautiful in that regard, so that we can become extended communities helping people who are entering this kind of space. And I just think that's going to be more and more important as we continue to age, all of us. And our healthcare systems, who knows how much more complicated they get, right? And how much more splintered in terms of specialties and what we need and what maybe we don't. And oh, by the way, in all of that growing pile of stuff, who do you trust?
Yeah.
So thank you, Debbie. I'm just
Susan,
delighted to have you. Last call for questions. It's 6:46, and I want to make sure that we respect everybody's time. Last call for questions, going once, going twice. You can find Debbie's information on my website, susanamarshall.com. I welcome your questions, your comments. If there's a topic that you would like to talk about for these compassion chats, absolutely get it to me. I encourage you to pick up the phone and call Debbie. She's the intake person and can answer whatever questions you have and can say, yeah, no, we don't do that, but let me help you get to someone who can help you with that. So our next chat is a month from now. I have the date written down here, May 25th. Marianne Garidi, who's going to join us to talk about her work, and the National Association for Senior Move Managers. Again, I'm like, who knew? I didn't know that existed. So join us again next month and the fourth Tuesday of every month. Bring your family, bring your friends. Finally, if you want a copy of that book, susanamarshall.com. You can find the link. Great Mother's Day gift. Probably not real happy, but I think very, very important. So Debbie, thank you again for being here. Thank you all of you attendees. Please come back and join us again.